All right, so the last of our long presentation is Belinda Boylson on co-pilot, also for South West Sydney Local Health District, on closing the gap in falls care. So falls follows on very well. It's partnering with New South Wales Ambulance for safer pathways, pre-recorded presentation. Oh yeah, so I'm not getting anyone up here. It's going to be here.
Hi, I'm Belinda from Co-Pilot in South West Sydney Local Health District, and I will be presenting today on closing the gap in falls care, partnering with New South Wales Ambulance for safer paths. This is a snapshot of our district of South West Sydney Local Health District. We are quite a big geographical area, and a significant portion, 48%, speak a language other than English. We have significant population growth within South West Sydney Local Health District, with our over 65 years population expected to grow by 74% by 2031 and over 92% in our over 85 years age group. Primary and community health within South West Sydney offers community-based programs for a wide range of health concerns, including acute and post-acute care. And the goal is to provide high-quality care that is provided close to home, to also support our hospitals to reduce admissions where possible and support early and timely discharges back into the community. Referrals come through an intake centre called I Hub, which streamlines referral pathways and ensures timely responses and consistent criteria is maintained. One of the services offered by Primary and Community Health is Co-Pilot, which is the Community Older Persons Intervention and Liaison Outreach Team. A community arm of Co-Pilot was established under urgent care funding at the end of 2023. And then existing ACOS-funded community outreach geriatric services that serviced our nursing homes or RACFs across the district were amalgamated into Co-Pilot in January 2024. The goal of Co-Pilot is to reduce low acuity ET presentations in older people aged 65 years and above across the district, and improve older people's experience accessing acute care, and to strengthen collaboration with primary care providers. Co-Pilot is a geriatrician-led multidisciplinary model supporting aged care clients in the community, RACFs or supportive care facilities. We provide urgent medical, nursing and allied health assessments for non-life-threatening conditions. Our RACF team has nursing and geriatrician cover with allied health support provided by the RACFs directly. And the community team has nursing and geriatrician support with allied health Monday to Friday, which includes physiotherapy, occupational therapy, social work, dietetics, and an allied health assistant. The primary aims are to avoid unnecessary hospital presentations at admissions and representations to ED, and also to expedite return to the community for RACF clients from ED and inpatient ward spaces. Co-Pilot operates 7 days a week, 8 a.m. till 8 p.m, and we cover the entire South West Sydney Local Health District. So this includes Bowral down in the south, all the way up to Bankstown in the north, which is approximately 6,243 square kilometres. Co-Pilot has extensive network and referral pathways that have been established. We take referrals from GPs, First Nations services, hospitals and nursing home directly, as well as New South Wales Ambulance Service. Previous data collection prior to Co-Pilot implementation showed that falls was one of the primary reasons for ED presentations in aged care clients across the district, and this was confirmed with Co-Pilot referral data showing falls as a primary referral reason, so we started with a falls pathway with the ambulance service. The pathway was developed with input from key stakeholders within both Co-Pilot and New South Wales Ambulance, and inclusion and exclusion criteria was established considering risk and patient safety. For example, exclusion criteria includes falls with head strike on blood thinners, which would require urgent and timely imaging, although we do consider advanced care directives or advanced care plans that include not-for-hospital transfer on an individual basis for our RACF patients. Falls with possible cardiac or neurological causes such as stroke, and falls with injury to head, chest, pelvis or hip that require timely imaging and potential specialist intervention are considered exclusions. Rollout included standing in busy EDs talking to paramedics whilst they waited to transfer their patients and promote the service. The referral pathway has a direct line for paramedics or VCCC staff to call through to the III intake centre and be transferred to a co-pilot clinician. This allows a clinician-to-clinician handover and triage to determine if it is appropriate and safe for the team to manage decline in the community, but it also provides the New South Wales Ambulance or VCCC staff with an immediate idea of whether the referral is accepted or whether escalation to ED might be needed. We have provided education sessions virtually to VCCC clinicians and paramedics, including in their orientation, and we have ongoing regular meetings with key New South Wales Ambulance staff to discuss referral numbers and to troubleshoot any issues or concerns from both sides. Based on the success of the falls pathway, we further collaborated with New South Wales Ambulance to broaden the intake criteria beyond falls, such as sepsis, respiratory concerns, bladder bowel issues, behaviour management concerns and more, all of which can also increase a patient in the aged care space of having falls. In the new pathway, we've also established clear exclusion criteria. Co-pilot staff also have access to the New South Wales Ambulance Medical Bookings Board and proactively monitor that for opportunities to identify potential referrals for RACF patients prior to the ambulance attending. Co-pilot staff contact the RACF directly to gather more information and triage the patient for appropriateness and to discuss stand down of the New South Wales Ambulance booking if they are suitable for co-pilot and the patient or next of kin and RACF staff are agreeable. Co-pilot also has a dedicated Teams chat and regular communication throughout the day with our district patient flow or sustainable access team that also monitors the medical bookings board and will flag potential co-pilot referral opportunities prior to New South Wales Ambulance attending. We have also implemented a dedicated ambulance response nurse who will assess and treat patients 16 years and over, but predominantly patients are 65 years and over, and assist in addressing urgent hospital avoidance activity in the community where they might normally present to ED, which often includes falls and imminent risk of falls. Co-pilot provides comprehensive management plans in collaboration with the GPs. So that might be an optimisation plan where we optimise health and wellbeing of the patient, the family and the carers involved in care. We might provide an escalation plan in the event that deterioration should occur. There's an action plan regarding referrals and contact information, and that might mean that they're able to re-refer to the service. And at times it's urgent plans. So where sudden deterioration may require an admission to ED, it will incorporate end-of-life planning for opportunities to avoid future presentations to hospital. Between 2024 and the end of March 2026, Co-pilot has had 11,580 referrals and completed over 36,000 occasions of service. Of those referrals, 1,169 were directly from New South Wales Ambulance and just under 5,000 directly from our RACFs. The vast majority of these patients have avoided an ED presentation, but at times, despite our best efforts, the patient may still require transfer to hospital for more specialised care or may represent for a cause unrelated to our episode of care. For example, we might treat for a UTI, but they may require admission subsequently for a cardiac reason, requiring specialty-specific intervention that's not safe or suitable to be provided in the community-based setting. In 2024 alone, Copilot achieved an estimated $5.51 million in cost savings by avoiding unnecessary ED presentations. This is data from the community arm of the service, and falls and imminent risk of falls remains the dominant referral reason for our elderly patients in the community, with over double the referral numbers of the next highest referral reason, which is functional decline and mobility issues that is also closely related to risk of falls in our elderly population. This is an RASCF patient story where we were involved with a 93-year-old female who had had 3 falls in a 24-hour period with head stroke within the nursing home. History of advanced dementia and anticoagulation. There was an advanced care directive in place saying not for hospital transfer. The nursing home was wanting to transfer based on policy and the fact that they were unable to contact the next of kin. So the concerns were this patient was having recurrent falls. The RACF was wanting to transfer via New South Wales Ambulance despite the advanced care directive, and the RACF was just not confident in managing this patient in the facility. The care was optimised in terms of patient was able to remain comfortable in a familiar environment and transfer to comfort care in discussion with the next of kin, and avoided an unnecessary ED transfer. The family were grateful for a timely intervention and for the level of comfort care maintained for the patient. We had an escalation point established which helped support the RACF and their concerns, and a falls management plan in place, and they knew they could reach out to us if anything deteriorated further. So you can see, with a good, clear, established link with New South Wales Ambulance, we are able to optimise patient care in the community and keep our elderly safe. South Wales Ambulance has extremely beneficial outcomes for our aged care populations, both in the community and our RACF across the district. Thank you for your time.
Thank you to Belinda for sending that recording through.